Returning now to our lead story at this hour, Northern Samar is under alert level 4 until the end of the month due to higher COVID-19 transmission and healthcare occupancy issues. For more on the situation there, we go above and beyond the headlines with Doctor Ninfa Caparroso-Kam, Northern Samar Provincial Health Officer. Doctor, thank you so much for joining us. Kamusta po ang situation ngayon sa Northern Samar? Ilan po ang mga kasong naitala ninyo ngayon?
Sa araw na ngayon po ay we have 455, which is an increase from our 359 from yesterday.
And
but our hospitalization has gone down from 69 to around 47 today.
And ilan po ang mga ospital sa Northern Samar are attending to these COVID cases?
Ang provincial hospital po, yun ang level 1. Ito po yung pwedeng mag-admit ng mga moderate cases. And then we have another level 1, which is 50-bed capacity. And then we have 7 other district hospitals na 10-bed capacity siya.
And among these cases that you have seen over the past week, no, Doktora, are there more patients admitted and needing critical care, or are there more mild to moderate patients isolating at home?
We have more mild to moderate, but the thing is, no, we have more incidental, na I would say incidental COVID patients. Ba't ko nasabing incidental? Pumunta sila sa hospital not because they're having symptoms of COVID, no? But ito ay manganganak, ito ay na-aksidente. It so happened that we did a swab and then nag-positive sila. So diretso sila sa COVID ward. So kukunti lang yung talagang pumupunta dito sa amin for COVID signs and symptoms. In fact, no, nung kataasan ng aming cases, no, I guess the highest that we have at the provincial hospital is 63. Aanim lang yung talagang nag-moderate na nangailangan ng oxygen. So we're seeing more and more mild cases.
And these mild cases, no, most of them are isolating at home. Minomonitor niyo po ba itong mga patients who have COVID in their respective residences?
Ang mga municipal, no, ang municipal LGUs, ang mga RHUs, rural health units, ito yung nagmo-monitor sa kanila. As far as the provincial hospital is concerned, we are monitoring those na na-admit dito sa aming COVID ward and our healthcare professionals who are in our isolation facility. So in terms of monitoring, yes, we do in terms of the numbers, no? How many are in isolation or in quarantine in different municipalities.
Doktora, yung Department of Health Eastern Visayas came out with an advisory, no? Northern Samar is part of Eastern Visayas. And they mentioned in their advisory about the reactivation of COVID-19 surge capacity and the increase of dedicated beds in all healthcare facilities. Kung marami itong more mild cases rather than severe cases, hindi po kailangan ito.
Kasi po, tulad ng sinabi ko, napakarami ng incidental, no? They came to the hospital not because they're having signs and symptoms of COVID, but because eto nga nanganak, no? Vehicular accidents, urinary tract infection, and other medical cases. Since it is our protocol, no, na lahat ng ina-admit dito ay sineswab, so it turned out that they're positive. So kaya napupunta sila sa aming COVID ward. As I've said, no, hindi karamihan ng na-admit namin are because they are COVID-related signs and symptoms na reason for admission.
So importante rin po itong reactivation, no, ng Department of Health Eastern Visayas. Tungkol po sa bakuna, how many now are fully vaccinated in Northern Samar and have been boosted?
I don't have the exact figures right now nung nagkaroon ng booster, no? But as of Monday, no, nasa 69% yung aming vaccination rate.
And are there still people, our kababayans in Northern Samar who are refusing to get vaccinated? Meron pa bang vaccine hesitancy?
Oh yes, definitely, no? Merong iba dyan na grupo because of religious beliefs. Meron naman dahil Itong mga to ay talagang nasa mga tinatawag natin GIDA areas, no? So difficult to go there. But nung na-impose yung hindi na pwedeng pumasok sa mga different establishments, ngayon dinadagsa ang aming mga rural health units, yung aming mga vaccination centers, no? Dati kaming naghahanap ng babakunahan, ngayon sila naghahanap ng bakuna.
And how are you convincing them po to get vaccinated and get protected from COVID-19?
Marami tayong meron tayong mga radio plugs, meron tayong mga pinapalabas ng aming Provincial Information Office. But as I've said, no, because inimpose na ng mga local government units, yung hindi pwedeng pumasok sa mga government and private establishments, yung walang bakuna at saka yung sa workplace, hindi pwedeng pumasok, no? Kung wala ka rin, hindi ka rin fully vaccinated, or in the absence of vaccination, you have to have your RT-PCR or rapid antigen at your own expense. Mukhang it's working, no? Hindi na namin kailangan kumbinsihin, sila na mismo ang nagpapabakuna.
Ayan, you mentioned po about testing, no? Do you think that there's sufficient tracing and testing in Northern Samar para makita po natin yung gravity, yung laki nitong Omicron or Delta sa probinsya? All right, we've lost our connection to Doctor Ninfa Caparroso-Kam, and we would like to thank her for joining us on Newsnight. That was